In a healthy body, after food is consumed, the carbohydrates are broken down into smaller molecules called glucose. The glucose is then released into the bloodstream from the digestive tract, causing an increase in blood glucose level. This triggers the hormone insulin. Insulin is a type of hormone which is released from the pancreas that helps the movement of glucose from the body and into the cells. Glucose is then converted into energy in the cells. However, in a person with type 1 diabetes, there is little to no insulin produced. This is due to partial or complete destruction of the beta islet cells in the pancreas. It is these cells that produce the hormone insulin in the body. So when there is little to no beta islet cells in the pancreas, there is little to no insulin produced. The cause of the destruction of the beta islet cells is either due to an autoimmune or idiopathic condition. An autoimmune condition means that the immune system in the body does not recognize their own cells as part of their body, and hence will attack and destroy them. The idiopathic condition is a fancy term for unknown causes. So, in a person with type 1 diabetes, after food is consumed and there is an increase in blood glucose level, there is no or not enough insulin released from the pancreas. This leads to glucose not being absorbed by the cells to be used as energy. Therefore, the glucose in the blood begins to accumulate, so even when the person is fasting, their blood glucose level is high. They are then treated with insulin, which is injected into them before a meal so that glucose is absorbed into the cells as it would in a normal body.
Risk factors of type 1 diabetes. First one, genetics. Genetics, the presence of certain genes, indicates an increased risk of developing type 1 diabetes. Second one, environmental factors. Environmental factors, some viruses may trigger type 1 diabetes. It's unclear which ones might be culprits. However, likewise, people from cold climates are more likely to have type 1 diabetes. Doctors also diagnose more cases of type 1 in winter than they do in summer. Third one, race. Race may be a risk factor for type 1 diabetes. It's more common in white people than in people of other races. Fourth one, family history. Having a parent or sibling with type 1 diabetes increases the risk of a person having the same type. If both parents have type 1 diabetes, the risk is even higher. Fifth one, age. Age type 1 diabetes usually develops in younger adults and children. It is one of the most common chronic conditions that develop in childhood. Children are typically younger than 14 years old when they receive a diagnosis. Type 1 diabetes might occur at any age, although developing type 1 diabetes later in life is rare.
The patient has the symptoms of passing more urine and being excessively thirsty. This is due to the deficiency of insulin. The glucose cannot be carried into the body cells to provide energy. Instead, there is an excessive amount of glucose remaining in the bloodstream, and this will force the kidney to excrete more urine to eliminate the extra glucose. This process of making extra urine will use up the water in the body. Hence, people have type 1 diabetes feel excessive thirsty. Secondly, when people have hypoglycemia and hyperglycemia, they will feel fatigue and always feel hungry. Hyperglycemia makes people feel fatigued because of the insufficient amount of insulin that can be used to carry glucose for energy conversion to the cells. Hyperglycemia makes people feel fatigued because the insufficient amount of insulin can be used to carry glucose for energy conversion to the cells. People who have diabetes also feel fatigued because strong diabetes medication make them hypoglycemia. The inadequate glucose in the blood cannot meet the cell's need for energy. Therefore, both hyperglycemia and hypoglycemia can make people feel fatigued. Hyperglycemia increases hunger in people with type 1 diabetes. The food of intake cannot convert it into energy because of the lack of insulin. The shortage energy makes patients feel hungry. Meanwhile, the patient has unexplained weight loss. This is due to the shortage of energy for the cells. The body begins to burn the fat and muscles to create energy to keep average body functioning. This process leads to unexplained weight loss. The fluctuation of blood glucose levels contribute to mood swing in patients with diabetes. Glucose is also a significant element which affects the brain function. When there is an inadequate amount of glucose for the brain is likely to become powerless. The brain cannot get enough energy from glucose. Hypoglycemia can affect the levels of acetylcholine. Acetylcholine is a neurotransmitter which transmits the signals between brain cells. These signals control both psychological and physical function. Furthermore, hyperglycemia can contribute to an increased level of glutamate, which controls emotions in the brain. Glutamate is linked with depression. People in type 1 diabetes will experience depression if hyperglycemia happens frequently.
Diagnostic testing for diabetes mellitus type 1. There is glycated hemoglobin, also known as A1C test, which is a type of blood assessment which measures the average blood sugar level from the previous 2 to 3 months. This is measured through the percentage of sugar bonded with hemoglobin, which determines the blood sugar level. The concentration of sugar in the blood will influence the amount of hemoglobin attached to the sugars. A high reading of A1C level would determine that there are high blood sugar levels and thus will establish the likeliness of diabetes. 2 separate tests must show a measurement of 6.5% or higher to confirm diabetes. 2 tests are performed to ensure reliability of the results. For random blood sugar test and fasting blood sugar test, this is used when the A1C test isn't available or when there are conditions present, such as pregnancy, that can cause inaccuracies in the A1C test. The random blood sugar test and fasting blood sugar test are the same. However, the difference is the timing and the results. In a random blood sugar test, this may be performed at random times during the day. The result of the blood sugar test is expressed in millimoles per liter, and if a measurement of 11.1 millimoles per liter or higher is recorded, there is highly suggestive of diabetes. However, for a fasting blood sugar test, a blood sample will be taken after the patient undergoes an overnight fast. If the result of this test is greater than 7 millimoles per liter, this will suggest diabetes. Now, you may be diagnosed with diabetes, but the doctor will not know which type it is until they run a blood test to examine autoantibodies that are present, which are highly common in type 1 diabetes. Also, presence of ketones in urine is also another feature associated with type 1 rather than type 2 diabetes.
During the hospitalized period for patients, with type 1 diabetes, there are some goals to achieve. The healthcare team needs to manage the metabolic state to return a stable glycemic balance for patients. The appropriate amount of insulin injection to match the glucose from food, which can make diabetes patients replicate the metabolism of non-diabetes. However, this is challenge work. Hyperglycemia and hypoglycemia are the results of the insulin injection. Therefore, healthcare team needs to manage the blood glucose level to ensure that the index is within limits. Also, the healthcare team needs to have the dietitian review and manage the fluid balance chart.
For my topic, my preference is patient-centered care, and which includes respect for patients' preference and values. It means at every step, patients should be given the needed information to make thoughtful decisions about their care. Those preferences should always be considered when determining the best course of action for that patient. The expertise and authority of practitioners should complement and enhance the patient perspective. Everyone involved is always on the same team, working toward the same goal. And the second and third one is emotional support and physical comfort. As a patient, they are healing their body, they are in pain, they are lonely, and as a nurse, it's really important to give extra emotional support and make them physical comfort. The fourth one is information, communication, and education. Alright, information, communication, and education. Like when the patients are fully informed, giving the trust and respect that comes with sharing all relevant facts, they will feel more empowered to take responsibility for the elements of their care that are within their control. And the next one is continuity and transition. Continuity and transition. A transition from one phase of care to the next should be as fluid and seamless as possible. Patients should be well informed about what to expect. Treatment regimens, especially medication regimens, should be clearly outlined and understood, and everyone involved should be able to plan and understand what warning signs and positive indicators to look out. The sixth one is coordination of care. The next one is the involvement of family and friends. Patient-centered care encourages keeping patients involved and integrate with their families, their communities, and their everyday lives. Practitioners should get to know the whole picture of patients' life, including the people involved who can provide the sort of support professionals sometimes cannot. Last one is access to care. Access to care to the extent that it's possible, patients should have access to all the care they need when they need it in a manner that's convenient and doesn't inflict too much added stress. It should be simple to schedule appointments, stick to medication regimens, and practice self-care.
To effectively manage type 1 diabetes, the patient needs to have a healthy diet, regular exercise, regular monitoring of BGL, and most importantly, insulin therapy. Insulin therapy is a lifelong management. There are 3 ways that insulin can be administered. It can either be via a syringe with a needle, an insulin pen, or with an insulin pump. According to Healthline, insulin is injected subcutaneously into the fat layer under the skin. Insulin can be administered into several different sites. It can be injected into the top and outer area of the thigh or at the back of the arms. But the most preferred injection site is the abdomen region, below the umbilicus. It is also important to note that people who regularly take insulin should rotate their injection site. This avoids the cause of lipodystrophy. Every patient is different, so their insulin regime will vary from patient to patient. The doctor will decide on the best insulin regime suitable for each patient. People with type 1 diabetes must have daily injections to help keep a normal level of glucose in the blood. Some people have a couple of injections throughout the day. According to Diabetes Australia, there are 5 types of insulins that can be administered, which are listed here. The difference with the 5 insulins are the duration time, so how long it takes to activate, how long it lasts, and the peak action for each insulin also varies. The first type of insulin is a short-acting insulin. An example of this would be Actrapid or Humulin R. This has a peak action of 2 to 4 hours. Then there's intermediate acting insulin. And an example of this would be Novolin N, Humulin NPH, or Protophane. This insulin lasts for about 16 to 24 hours. Then there is also a long-acting insulin, and this gives a slow release of insulin over a period of 24 hours. An example of this would be Lantus or Levemir. Long-acting insulin is usually administered at night before the patient goes to bed. Rapid-acting insulin is another type of insulin that can be administered. An example of this would be Novorapid, Humalog, or Epitra. This is a fast-acting insulin, so it starts to work within 15 to 20 minutes. Mixed-acting insulin is another type of insulin. This is a mixture of 2 types of insulin in one injection. It's a mixture of intermediate-acting insulin combined with either a rapid-acting insulin or a short-acting insulin. An example of this would be Novamix, Mixstart, or Humalog. As you can see from the listed insulins, the duration time, activation time, and the peak action time for all insulin all varies. Because there are different types of insulin, it's important to follow the insulin regime which was prescribed by the doctor. This will help keep the BGL level within the normal range for the patient.
Type 1 diabetes has both long-term and short-term complications. Short-term complications of type 1 diabetes include hypoglycemia and hyperglycemia. Hypoglycemia is when the blood glucose level of a person is too low, usually less than 3.9 mmol per liter. This usually occurs when there is an overdose of insulin, not eating enough for the dose of insulin received, exercising too hard, or skipping meals after receiving a dose of insulin. Hyperglycemia is when the blood glucose level is too high, usually over 11.1 mmol per liter. Hyperglycemia occurs when the dose of insulin administered is inadequate for the amount of food eaten. Influenza or stress can cause incidences of hyperglycemia due to the fight or flight response from the sympathetic nervous system that causes hormones such as cortisol to be released. Such hormones can cause a counteracting effect to the insulin by releasing glycogen, which is stored glucose, into the bloodstream, therefore causing an increase in blood glucose level. If severe hyperglycemia goes unmanaged, it can cause diabetic ketoacidosis, which is a very serious complication of unmanaged diabetes. Unmanaged hyper or hypoglycemia can result in diabetic coma or even death. Other short-term complications of type 1 diabetes are lipohypertrophy, lipoatrophy, and erythema. These complications often occur when there is infrequent change to the insulin administration sites and can be painful, disfiguring, and affect the glycemic control. Long-term complications are divided into microvascular and macrovascular conditions. Microvascular conditions are due to damages to the small blood vessels and cause conditions such as diabetic retinopathy, diabetic nephropathy, and diabetic neuropathy. Diabetic retinopathy is a condition that affects the eyes and can lead to blindness. Diabetic neuropathy is a condition that affects the nerves that causes impotence and diabetic foot disorders, and diabetic nephropathy is a condition that affects the nephrons in the kidneys and can lead to renal failure. Macrovascular conditions are due to damages to the large blood vessels and causes cardiovascular diseases such as stroke, heart attack, and peripheral artery diseases. Peripheral artery diseases where there is poor circulation to the arms and legs and consequent in poor healing of wound.